count. And again, this is we say it's training, but realistically, it's information, especially for those that may not have done the point in time count and the hit count before. This is more of information, trying to give you as much information about the point in time count and about the housing inventory count. So again, 2024 point in time count training for the balanced estate continuum of care. Next slide, please. Great. Uh-oh. Give me 1 second, folks. I just lost you guys. There we go. Now you're back. So why do we participate? Again, the main thing is because this is a federal requirement. Again, the data that's collected identifies communities, and it helps us determine the level of funding the communities need in order to address homelessness. Again, the information that's gathered is used in community planning, and it also helps us determine the geographical areas and the subpopulations that are most negatively affected by housing instability. All right. So what is a point in time count? All right, a point in time count, it's a 1 day count of people experience homelessness in our community. Again, note that the PIC count is conducted in conjunction with gathering data for the housing inventory chart. Also required, this is also required by HUD. And again, some basic information about the HIC. It captures information on all homeless services providers in our community, including emergency service, emergency shelter, transitional housing, rapid rehousing, and permanent supportive housing on the one night of the PIC count. This information includes the number of people currently being served, as well as the capacity of these programs. Again, the data on rapid rehousing and permanent supportive housing is not included in the COC's PIT numbers, but is required by the housing inventory count. Next slide, please. All right. All right, when is this year's count? Again, hopefully that information has been sent to everybody. It will be Wednesday, January 22nd, 2025. Again, that means everyone who is homeless on that night, all the way into the next morning, will be counted. So the count should start at 6 p.m., that's at dusk, and it go to 6 a.m., which is dawn. Days counted on the 22nd, where will you sleep? And the day counted on the 23rd, where did you sleep? Next slide, please. Okay. Again, the information about who is counted. Again, our goal is to count all people in the continuum who meet the HUD requirement for being homeless. Again, this includes individuals and families. So information here is, again, we're going to use living in a supervised, publicly or privately operated shelter designed to provide temporary living arrangements, including congregate shelters, transitional housing, hotels, motels, paid for by charitable organizations or by federal or state or local programs for low-income individuals on the night of the count, which is in response to HUD's 2014 guidelines. Okay. Note also, this includes domestic violence shelter providers or providers, period. With a primary nighttime residence that is public or a private place not designed for or ordinary used as a regular sleeping accommodation for human beings, including that's called cars, parks, abandoned buildings, bus stations, train stations, airports, campgrounds. Again, all this is going to be counted on the night of January 22nd, in accordance with HUD 2014 guidelines. Next slide, please.
Woodward is going to visit with
Okay.
Caitlin as the visit supervisor with Thorne, 4:30 p.m.
Oh, we got some. Okay, thank you. All right, who is not counted? All right, we don't count persons residing in permanent supportive housing programs, including persons that are in VASH, which is the Veterans Affairs Supportive Housing, persons residing in rapid rehousing projects and receiving rental assistance, those who are housed and not just enrolled. Persons counted in any location not listed on the HIC, staying in projects with beds or units not dedicated for persons who are homeless. And we'll continue. Next slide, please. Also, persons residing in hotels paid for by themselves, persons residing in institutions such as jails, juvenile correction facilities, foster care, hotel beds, or detox centers. And also persons temporarily staying with family and friends. Again, that's doubling up or couch surfing. And also persons residing in overcrowded or substandard housing. And so, when it comes to HUD required demographics data, COCs must provide demographic data for both sheltered and unsheltered persons according to the following guidelines: households with at least one adult and one child, households without children, households with only children under the age of 18, and veteran households with at least one adult and one child, and also veteran households without children. And we'll continue. Next slide, please. Also, unaccompanied youth, that means under the age of 18 or age 18 to 24. And for parenting, that'll be under the age of 18 or aged 18 to 24. Next slide, please. And so the following data elements are collected on all sheltered and unsheltered persons: their age, again, adults and children, the race and ethnicity, again, adults and children, and gender, again, adults and children. All right. And we'll continue on. The following data elements are collected on all sheltered and unsheltered persons. Again, chronically homeless individuals, adults, chronically homeless families, all household members, adults with serious mental illness, adults with substance use disorder, adults with HIV or AIDS, and adult survivors of domestic violence and currently fleeing. All right. So continuing on, HUD is requiring that COCs report who is chronically homeless based on a chronic homeless definition that went into effect on January 2016. A chronically homeless person is homeless and living in a place not meant for human habitation, a safe haven, or in an emergency shelter, has been homeless or living or residing in a place not meant for human habitation, a safe haven, or in an emergency shelter continuously for 1 year or at least 4 separate occasions in the last 3 years, where a combined length of those occasions is at least 1 year. Has a diagnosed and also has a diagnosed disability. Next slide, please. And I think I'm going to turn it over to Brianna.
That is right. Thanks, Dr. Wilburn. So, leading up to the point in time count, organizations should update their by name list. On the night of the point in time count, you all will not be administering the ISPDAT and would likely be identifying a person's location for a future screening. This can include creating a plan with the individual to follow up with them at their location or providing them with the contact information for the community's access points. All right, so local planning groups should be following these steps prior to the point in time count. You should begin organizing on a local level and inform stakeholders of the date of the point in time count. Become familiar with the survey tools that will be used during the count. At the local level, determine whether there are any services or other programs where you can count individuals. And lastly is to become familiar with the guidance provided by the Virginia Department of Health and the Balance of State. So local planning groups should develop a plan for identifying and counting unsheltered individuals and those who are in emergency shelters and transitional housing facilities. You should also assess the resources that can help with the point in time count, identify agencies, shelters, police, and other businesses, and that is not an exhaustive list as well. So ensure you are organizing agency staff and volunteers from your local planning group. And it is key to note here that HUD encourages communities to focus on recruiting volunteers for the point in time count from within the local planning group membership and homeless services. Also, if you have not already, please send the name of the point in time count coordinator and the contact information for this person to Dr. Wilburn and I. In addition to this, please send the completed contact list to Dr. Wilburn and I by February 3rd for all of the agencies who will be included on the housing inventory count. And this includes emergency shelters, transitional housing, permanent supportive housing, rapid rehousing, and other permanent housing programs. So during the count, your local planning group should implement your plan to count, survey, and assess all unsheltered individuals. Community partners should complete the count and ensure that everyone is adhering to the guidance provided from the Virginia Department of Health and DHCD, and also ensure that all shelters, including non-HMIS using shelters, administer surveys and the VI-SPDAT if not yet assess, and it is appropriate for all adult clients spending the night in the shelter on the night of January 22nd. HMIS shelters should work with Homeward to ensure that the HCIS report on all sheltered individuals is correct. For example, all individuals included in the report are correct and their information were accurately recorded. As well, ensure that housing inventory information is correct for the night of the count. HMIS shelters should ensure that by February 6, 2025, all client entry/exit data is up to date through January 31st, 2025. And then between February 6th through the 12th, Homeward will be sending reports on agencies' clients sheltered on the night of January 22nd. Between February 12th and 28th, agencies should work with Homeward to resolve any data issues and confirm that data is correct. And then on February 29th, Homeward sends data on each shelter that uses HCIS to the balance of state staff. All right. So the local planning group's representative on the steering committee should have this information on the timeline for when forms should be submitted, but please refer to this grid for the different due dates. And then this PowerPoint will also be sent out and available in the point in time count housing inventory count teams, where all the PIT and HIC resources will be located. So this will not be the last time that you all see this. So we will be using Google Forms again this year, and communities may choose to use a hard copy survey. However, the survey will still need to be entered into Google Forms in order to be counted for your community. The youth addendum should be utilized for individuals or households who are 18 to 24, both in emergency shelters and for those calling who are unsheltered. You should administer the youth addendum to the best of your ability. We wanted to spend some time going through some of the guidance provided by the Virginia Department of Health. So please limit the number of volunteers you are going to use during the point in time count to only staff and members of your LPG partner agencies. In addition to this, any individual who fits in the high risk populations as identified by the CDC should not participate in the point in time count. It is also highly encouraged for individuals who are surveying to be fully vaccinated and/or have a booster if they are fully vaccinated. This is to ensure the safest possible interaction with individuals experiencing homelessness. And based on illness rates and need in the community, volunteers and those who are conducting the count should wear a mask. Whenever possible, it is highly encouraged that volunteers offer masks to individuals they encounter prior to their interview. And then masks should not be placed on children under 2 years old, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. So continuing on with guidance from the Virginia Department of Health, based on illness rates and need in the community, maintain a distance of 6 feet between other volunteers and clients. It is encouraged that staff and volunteers monitor their health in the days leading up to the count. And then if an individual is sick, they should not participate in the point in time count. Please ensure your community is keeping track of the individuals you are encountering. In the event that someone finds out later they have a respiratory illness, this will help identify who may need to be notified that they have been in close contact with an individual experiencing symptoms. We also wanted to spend some time going through some suggestions around surveying people during the point in time count. And these suggestions may differ based on whether the person is sheltered or unsheltered. So, shelter providers may choose to hand out hard copies of the surveys at a convenient time and ask people to complete them. If you choose to hand out surveys, please remember to collect the surveys once they are completed. People who are unsheltered may be approached on the street where they are camping or wherever you find them. For individuals who are encountered on the street, the survey tool should be completed. There may be programs in your community that serve people experiencing homelessness on the day of the count or after, so you should coordinate with these programs to administer the surveys to people who may be living in unsheltered conditions. In order to be counted as unsheltered, the individual would have needed to be unsheltered the night of the 22nd. All right, so continuing with suggestions for surveying people, surveys should only be administered to the individuals over the age of 18. Survey administrators should also make sure that the individual that is engaged has not already taken the survey. Whenever possible, the administrator should ask all of the questions on the survey, and no answer should be assumed, such as race and ethnicity or gender. A suggested way to address this with a client is saying something along the lines of, I'm about to ask you some questions, and you may think that the answers are obvious, but I'm going to ask them anyway. The survey is always optional, so a client can always decline completing the survey. And then we also want to ensure we are protecting the personal information of the clients we are engaging. So if you are administering the survey verbally, try to speak quietly or shield others from hearing your conversation. Other suggestions for surveying people include making it known that the information about a single individual will not be singled out and the survey is anonymous. If you are offering any incentives to take the survey, let the clients know. To encourage people to take the survey, explain who you are and who you represent, and while it is included on the survey, try to explain to the clients why we are collecting this data. And that is primarily to get an understanding of the needs of our community, and that this will help the community obtain additional resources to meet those needs. And finally, agency staff and community members may encounter individuals in programs that serve people experiencing homelessness and people not experiencing homelessness. In these scenarios, where the individual slept on the night of the point in time count will determine whether the person will be included in the point in time count numbers. Right, and now I'm going to pass it back to Dr. Wilburn to briefly walk through the PIT survey with you all. And I think you're muted, Dr. Wilburn.
Thank you, because I couldn't see that at first. I was like, oh my goodness, that is a little bit small. Okay, so the Virginia Balanced Estate COC point in time count, again, January 22nd, 2025. Again, the form itself, again, we're going to start at the top here. You're going to put down your local planning group, your county or your city, and also to the person that's doing the interview itself, and the place of contact if it is unsheltered. Again, please complete one survey for each homeless individual or unaccompanied youth who is sheltered or residing in a homeless program on the night of January 22nd. And also, too, just as a reminder, if the resident is residing with a family group, then any information for the minor children should be recorded. You should record, the head of household as a response. Separate surveys should be completed for each individual and adult household member. Again, also too, where did you sleep or where will you sleep on the night of Wednesday, January 22nd, 2025? And again, these are the responses down here that you would, again, record the one that's applicable. If staying in an emergency shelter or transitional housing program, please provide the name of the program, such as Salvation Army, YWCA, or so forth and so on. Again, the demographic information is very, very important as well. A respondent's household description. Again, head of the household or adult member of the household. And again, the first letter of the first name, excuse me, the first two letters of the first name, the first two letters of the last name, and of course, obviously, the gender in itself. Please select one that best goes with the individual. And also to the age range. And also to, you're gonna, if you know the exact age or if they give the exact age, please put that down. And then the race and ethnicity, please select what applies. And then again, if you can get the client's initials there, that would be greatly appreciated. And again, if they're military or if they're a veteran, it's yes or no, or they don't know or they refused. Okay. Are you currently pregnant or expecting to become a parent in the next 9 months? Please, whatever applies there. And also, too, do you have children under the age of 18 staying with you? Pick the one that best suited there. If children are with the head of household responder, please complete the following demographic information for each child. Okay, so that has to be done on each child. Is this the first time you have been homeless? And again, please complete that in the next section there. Also, too, if not, again, in the past 3 years, how many times have you been homeless, a mercy shelter, or a place not meant for human habitation? Again, the number there. And also, how long have you been homeless? This time, only include time spent staying in shelter or on the street. And in section 6 there, have you been homeless 4 or more times in the past 3 years? What is the approximate time, total time you've been homeless? Again, what's applicable there? If you please get them to initial there as well. And also, section 7, do you identify as your primary, what do you identify? I'm sorry, Brianna, I'm looking real closer. What do you identify as your primary reason for being homeless or unstably housed? Please check which applies there. Are you currently, and number 8 is, are you currently experiencing homelessness because you're fleeing domestic violence, dating violence, sexual assault, or stalking? And do you receive SSI or SSDI or disability check? And again, that's yes or no in section 9 there. And in 10, do you have substance use disorder or serious mental illness or developmental disability or chronic physical illness or other disabilities? Again, yes or no, that goes in 10. And 10A, if yes, do you have any of the following disabilities or long-term illnesses? And then you're going to check there. And then section 10B, does this disability or illness limit your ability to get or keep a job or take care of your personal matters, such as taking care of yourself, taking medication, a doctor has a medication that a doctor has prescribed, taking care of your children, or going shopping, or getting around the community? Again, that's yes or no as well. And I believe that's it, right, Brianna? Cool. Something I want to just make mention of real quick on the Google Forms. I know sometimes there are a few of you out there that have your own form, but if you use your own form, you're still going to have to please remember to submit it on the Google form. That's what we're going to need. But again, we have to be consistent in order to be in compliance with HUD. And also, too, in regards to volunteers, I know some of you, we talk about what volunteers you can use or should use. Again, please remember, it's important when it comes to volunteers, using people that are your partners, or using people, again, that have the proper training in order to conduct this point in time count. And also on slide 22, I believe it said 1 January 2024. We'll make sure we change it to January 22nd, 2025. I saw that as well. So, Brianna?
All right. Thank you, Dr. Wilburn, for going through that piece and also highlighting that error on the slides.
Oh.
All right. So this is the Teams page that will contain all the information for the point in time and housing inventory count. And then point in time and housing inventory count coordinators will have access to this space and resources, and we'll share this out with other community partners who will be participating. So where should you all send your HIC forms to? You should send your housing inventory account forms to Dr. Wilburn and I. There will also be a housing inventory account training scheduled for January 7th at 1 p.m. And then if you are the housing provider in the community or the point in time count or housing inventory count coordinator, you should plan to attend this training as we will be going through the housing inventory count form. All right, so we do recognize that was a lot of information in a short amount of time. So we're going to be leaving some time for questions. So feel free to come off mute and ask your questions, or you all can just drop them in the chat, whichever you all prefer.
And I will say, John asked about military. Yes, it's on the form about military. Yes or no, or unknown, or refuse the answer. So it is on the form.
Hi, Darrell and Brianna. This is Craig McCroskey. I have a question. The Google form, is that only for the main form, or will there also be a youth addendum online form?
You want me to answer that one, Dr. Wilburn, or you want to?
Yes, you can, because Craig always has these funny questions.
Okay. So the Google form is basically going to be submission of the forms that will be provided to you all. So kind of all that to say that there will be two different forms, one for people who are over the age of 24 and their households, and then one form specific to youth as well.
Thank you.
And then
Kike, go ahead with Kike. Yeah, go ahead.
all right. Kiki said, some folks, when asked how many times have you been homeless, don't know how to answer the question, or they'll say something vague. They may say something like, I've been homeless for the past 5 years. Are we supposed to go in depth and explain that question as far as episodes to get a clearer number? If so, can you all explain that for folks that may not know what episodes are? And I'll let you take that one, Dr. Wilburn, and then I'll jump in.
Yeah, Kiki, and here's what I say. The more information, the better. Again, just do the best you can in trying to gather that information. Again, and I would also say, Brianna and I will be out on the night of the 22nd and 23rd. So again, if you do encounter something like that, then certainly, sometimes sometimes it's better. You can just give us a phone call that night, and we can kind of walk through that process with you. But yeah, just do the best you can, because again, I do understand that some folks may not clearly understand that, but just do the best you can, like I said, or you can just reach out to us on that night, and we'll try to walk you through it the best we can.
And Caitlin, I see you have your hand up, so go ahead and ask your question.
Hey, Brianna. Hey, Dr. Wilburn. So quick question for the both of you. Hopefully I'm not freezing. I feel like I'm freezing on my end. So we had the question in cash. We, prior to last year, had a few volunteers who kind of work within the continuum, but they're not necessarily, well, they volunteer within the continuum, but they're not necessarily like homeless system providers. Can they volunteer on the night of the pick count, or HUD's not allowing that anymore?
Again, here's what I say. If it's someone that that again has gone through this process, and that they're reliable, and I would probably say not only that, but if they're going to be teamed up with someone from your organization as well, then I'd say no problem there, because it could be they're there together and they encounter two people. They grab one, another person grabs one, and as long as they're coming back with the same information, yeah, that's fine.
Okay, yeah, they would be with someone. So they've done it in the past, done it
Yeah.
many times in the past, and not only that, they would be with someone that's a seasoned. They've done this for a long time. They've done many pit counts, so just wanted to make sure.
Absolutely.
Awesome.
And Leslie,
Thanks.
thank you, Caitlin. Leslie, in regards to your question, again, will there be any type of security provided for volunteers while, again, that's something that you have to rely on with your COC. I will say this, there are some local planning groups out there that have the assistance of their police department and sheriff department. I know in Tri-County and some other places, their police and sheriff department help them clear locations for homelessness. That's it's like a dual situation where they're there to help, but also too they're there as a safety precaution as well. So I would just say if you have the availability of your police department and there's someone as a partner that again gets involved in the pit count, then there's where you'll get that additional support. But there is nothing directly out there for the security of your volunteers.
Okay, thank you.
Mhm. Good question.
And then Leslie, Kiki Cody has also provided you a response in the chat that's more specific to the cache region as well.
Oh, okay, thank you.
Yeah, Brianna and I will be out in West Piedmont, in that area for the pit count. So again, we will be out. So again, if you guys have any questions or something that you guys want to just run by us, again, please, just give us a phone call. We will be out and about that night. So. Great questions today.
I had a quick question.
Sure.
Just for reasoning to find out ourselves, but what is the reasoning behind going out at the times that we're going out? Because what we have discovered here in Danville is we found two separate locations that are down behind buildings that are further down in where a creek. So what they've done is they've tied plastic bags around small trees to maneuver. But when you go down, you see hammocks, you see like fire pits that have been set up. They're all down there. So by you going out at that time of the evening, the safety measures, I think people kind of settle more. Wouldn't it make more sense to find people during the daytime when they're out and about, searching shelter and searching for food, so to speak? But at that time of night, it's more dangerous going down through the woods when you're going in someone else's habitat, so to speak. So how would we address that? And just what was the reasoning again behind going in the dark?
Yeah, absolutely. And that's a good question. So the pit count happens throughout the United States on the same day, at the same time for everybody. All right. So that's not something that we can change. That's a HUD requirement there.
Right.
Again, I would say the same thing, going out during the daytime, certainly. But again, it's that sleeping process. And again, I have to believe that's why HUD wants it to happen at night, because we're looking for where people are at that particular night. I would definitely say, in terms of, that security piece of it again, that's why for me, I would encourage if at all possible, you go out in twos. That's not something we specifically say that you have to do, but I would definitely encourage going out in twos. So that way, again, there's a little bit of a security there if something were to happen. But I hope that addressed that piece of it. Yeah, if we could change the time and how, when we go out, certainly I would be all for it, because again, it is the security, of it, but also too, I'm understanding that that's something that that day I can, my responsibilities, I kind of advocate to HUD, but again, they set that, so it's universal.
Yeah.
Good question.
And I want to piggyback off something Dr. Darrell said. He said always go into, and I just kind of want to reiterate, don't go alone for the safety of yourself as well.
Yeah. Some of y'all been doing this for a long time, and I know you're seasoned, and I know you know where you can go or where you may not want to go by yourself. But again, it's all about the safety of you while you're out there. Because again, this is something we all know. Sometimes encountering people at night, and they're not used to people coming up asking them a bunch of questions, especially if someone may not be quite stable. Again, there's where even whether again even if you're seasoned or not, still you want to make sure you're aware of your surroundings and aware that you possibly have someone else with you, so that way if something were to happen, you have some support there. That's why I bring Brianna. That's my support. Something happens to me, she's gonna be running. So any other questions? That's good questions. Glad you guys are asking questions here. I will also talk about, again, this year we reached out to Virginia Department of Health, asking them were there any additional things that we need to be aware of this year, just like last year. And again, it's just the mere fact that they stated, again, just being cautious as usual. There's again, the virus is still out there, and I would just say, again, if you have the opportunity to wear plastic gloves, because again, if you want to hand somebody your clipboard and have them fill it out, again, just being cautious about that, and handling things when you get something back from someone, or the pen, or whatever the case may be. But just being cautious, because again, want you guys to be safe, as well as we want the person who we're encountering to be safe as well. So just think about the plastic gloves, the disposable plastic gloves as well. Any other questions? Okay. For those that are new, again, as Brianna stated, this will be available. And again, if you have any questions, please don't hesitate to reach out to Brianna or myself. Again, we know we've got some time. The hit count training is coming up next month, but again, just want to make sure, especially when it comes to folks, and again, trying to look for people that are going to help you out with the pick count. Again, please just be mindful of that piece of it. Again, I said that last year. Again, just when it comes to those volunteers, or when it comes to your partners, again, just making sure that they understand the information that's needed on these forms, because it's very important. And again, I'm going to say this one more time. If you're going to use your own form, just make sure we get it back on the Google form. Again, last year we had some folks trying to send us their form. And again, that just bogs down the process of what we need. Well, I should say it bogs down the process of what Brianna needs to do in order to capture the information. So please just make sure that you're using the correct Google forms. Anything else? Anybody? Okay. For everybody, I believe everybody should have received an email from Brianna or myself for in regards to next year's visits. I've made my visit plans for 2025 already. If you have not seen when I will be coming out, I would encourage you to get a hold of your local planning group or your COC, because everybody has the dates when I will be out there visiting. For the most part, some weeks Brianna will be out in the area Brianna and I will be out in your area for a whole week. And then for the most part, some weeks we'll be out there for 2 and 3 days, because I want to make sure that we're spending time next year visiting everybody, and I want to spend quality time, because again, I want to view your operation, the good things that you guys are doing, and not only that, but go over some information about the balance of state, especially since next year we don't have a NOFO. I want to spend some time with some folks talking about projects that you may want to submit to the balance of state to consider. So again, please get a hold of your local planning group. Everybody has those dates, and for the most part, I believe everybody's pretty much responded on the dates that I've sent out. But looking forward to coming out next year and spending time, some quality time with everybody, and going through and viewing all the great things that you guys are doing out there. So I'm looking forward to that. All right. Well, Brianna, anything else? I know we got about 13 minutes left. Anybody want me to play Boys and Men Let It Snow again? No, I'm not going to do that. That was my song. We had our Christmas party on Friday, and that was my favorite song. I kept hitting repeat. So again, I don't want it to snow, but some of you may want it to snow. So
But Dr. Wilburn and Brianna, we are definitely looking forward to y'all coming out here to the Tri-City area. That was something that we discussed with our board as well. Being able to have that physical visit makes a big difference. So thank you all so much.
absolutely, it is definitely our pleasure. I'm looking forward to seeing everybody. I know Brianna as well. It's gonna be for me. It's and I'm sure Brianna as well. It's gonna be a joy to spend quality time in 2025. That's why, again, some areas we're in there for a whole week, and in some areas, again, the minimum I think we're gonna be spending is 2 days. Because again, I want to walk through and see the great things that you guys are doing and see what we can do um, um, to help out from the balance of state standpoint. So again, I think it's important. So definitely looking forward, and thank you guys for responding too, and I greatly appreciate you guys allowing us to come out and spend time with you. So I think DRHA, you guys are the first up next year. I think because we're doing the pick count out there in West Piedmont, we're just going to just stay there. So looking forward to. I don't want to come back. I said I'm just going to stay out there. So looking forward to that as well. If nobody else has anything at all, I'm going to give you guys 11 minutes back of your life. Again, please enjoy the holiday. I can't stress enough how much I appreciate the hard work that you guys do out there, and I greatly appreciate everything you guys do for the folks in your community. It is hard work, and I recognize that, and it is something that I just, when I get those phone calls from folks looking for services, I'm always glad to refer them out to you guys, and it's always a pleasure knowing how well you guys take care of people. So again, if we don't speak to you before Christmas, please have a prosperous Christmas. Please spend time off as best you can. I know that some of you will be working, and I know I'm gonna be on call for our unit. But please enjoy the time, and again, thank you so much for what you guys do. Brianna, you have anything?
Not really. I just want to say that if you all need any support when you guys are going through this planning process or even leading up to the point in time count, please do not hesitate to reach out to us. That is what we are here for.
Yep, absolutely. Craig, looking forward to seeing you, man. You can come off mute and tell me something.
Sorry about that.
It's all right.
Good to see you.
Yep, looking forward to it.